When should COVID patients stop isolating and rejoin the world? Right now, some people need to have a negative test to return to school or to the workplace. KVUE's Luis De Leon joins us now live. And Luis, the Texas Medical Association now says we should do away or do things in a different way.
Yeah, Brian, the doctor I spoke to today said that testing just hasn't been as effective as they'd like it to be, saying that the nasal swab test at times can still test positive for the genetic material of COVID-19 when that patient actually is no longer infectious. So TMA leaders say when it comes to going back to work or school, that it should be based on symptoms instead of testing. Research has found that someone with mild to moderate COVID-19 symptoms are usually only infectious for up to 10 days after they started feeling sick. So TMA says you can return to work or school after that point, as long as you haven't had a fever for 24 hours and are feeling much better, of course. Now, as for returning to school, they say it should be on a case-by-case basis.
You have to look at the particulars around, number one, what's happening in your particular community. You know, what is going on in terms of the number of cases that are happening in the environment all around you. Number two, what is that facility environment going to look like, perhaps in a classroom setting?
The Centers for Disease Control guidance also says testing is no longer recommended to decide when to stop staying home. Austin Public Health said last week that they support that guidance from the CDC, also saying that the focus of the free tests is to show new cases to help prevent the spread of the virus, not to retest recovered patients. Live in downtown Austin, Luis De Leon, KVUE News.